Are you following a ketogenic diet and curious if carb cycling might be a beneficial or at least not a harmful approach for you? Well, we've heard from a number of people wondering about this, so I wanted to go into more detail about how to think about carb cycling and when it could help, and perhaps most importantly, when it may be detrimental. As with many things, much of how we answer these questions depends on why you're using ketogenic therapy or a keto diet in the first place. So let's get into the details. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. I'll try to break down why some feel carb cycling is beneficial, who could benefit, and perhaps most importantly, who likely should not carb cycle. But before we go into the details, please remember, our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have potentially dangerous effects if done without proper supervision. Consult your healthcare provider before changing your lifestyle or medications. In addition, please recognize that people may respond differently to ketosis, and there isn't one recognized universal response. So first, let's start with some definitions. So carb cycling, as it applies to a ketogenic diet, is any planned temporary or cyclical increase in carbohydrate intake that likely results in exiting the ketogenic state. So for some prescribed period of time, either days, weeks, or months, someone follows a very low carb diet to stay in ketosis and then purposely increases carb intake to come out of ketosis. And again, this can last for days, weeks, or months, depending on your goals. And whether or not someone should try carb cycling really has to do with those goals. Are they eating a keto diet to be metabolically healthy, to lose weight, or to treat a psychiatric or other brain-based disorder? They will each likely have a different answer. And the short answer is that most people using ketogenic therapy to treat a medical condition likely want to avoid carb cycling, or at most, try it very carefully with the guidance of their healthcare team. But there's no evidence that carb cycling is healthier or being in sustained ketosis is dangerous, especially when it's successfully treating a medical condition. But there's more to consider with carb cycling, so let's dig a little deeper. Now, people may advocate for carb cycling for a number of reasons, including concerns that maybe we shouldn't be in ketosis all the time, the potential athletic performance benefits of carbs, that we should adjust carb intake to natural hormonal variations like a woman's menstrual cycle, or simply increasing carbs increases the variety in food choices, and other reasons. But here's the thing. None of these are absolutes. For instance, just because our ancestors were likely in and out of ketosis based on the season and food availability, that doesn't mean that we need to go in and out of ketosis. We really don't have any hard data that long-term ketosis is harmful, or that cyclical ketosis is better. It has more to do with feelings and beliefs than data. And then how about when it comes to athletic performance? Again, what are your goals? Are you a professional athlete or competing in the Olympics? Or do you want to work out and exercise for fun and overall health? There are plenty of examples of athletes thriving in ketosis. And then others, like I've heard from many like Brazilian jiu-jitsu practitioners who need to carb up for the series of short, intense bursts that's required with jiu-jitsu. But without getting into the details of keto and athletic performance, maybe we'll do a separate video on that. It comes down to how do you feel better and how do you balance your health goals and your athletic goals? For instance, if you use ketosis to put bipolar disorder into remission, but you like your athletic performance better off keto, it may not be worth that small advantage in the gym to carb cycle and run the risk of your bipolar disorder coming back. And again, this isn't an absolute, but it is definitely something to consider as you weigh the risks and benefits of your health versus athletics, right? And it's not like people can't exercise in ketosis. Of course not. Instead, it seems that, it's the competitive outliers who feel they reach their peak performance with carbs, and not all of them. But that has little application to most of us. And the same concern holds for other reasons of carb cycling. If you're treating a medical condition with ketosis, there is always a chance that the condition may worsen off ketosis. This is likely most pertinent for brain-based disorders like epilepsy or mental illness, but also potentially cancers or even type 2 diabetes. Now, that being said, we know of some individuals who are in strict ketosis Monday through Friday and come out of ketosis on the weekends and are able to do this without the return of their psychiatric symptoms. Yet on the other end of the spectrum, some individuals notice an unwanted return of symptoms simply if their ketones fall below 2, right? So there's likely a great deal of individual variation. So usually the safest approach is to remain in ketosis and of course discuss any potential experiment or of carb cycling with the healthcare team, carefully weighing the potential risks and benefits. And here's another crucial point. What are you carb cycling with, right? We have to address that. Are you carb cycling with sweet potatoes and lentils and beans, or pizza, pasta, cookies, and ice cream? As you can guess, the quality of carbs still matters for your health. And if someone has a tendency towards sugar addiction, the cycle could become very problematic. So it's important to maintain very high quality fibrous carbs when you're cycling. But here's another personal opinion caveat of carb cycling. So my opinion, I believe that if someone is going to cycle, it's best to do it for more than just a day or two. In fact, a week or more might be the minimum in my opinion. And this is because when you're in ketosis and start eating more carbs, you will likely have an acute rise in blood sugar and possibly inflammatory markers. So your body's simply unprepared for the acute onslaught of carbs, so to speak. But after a couple of days, that starts to equilibrate. Now, we don't have great data on this, but based on what the data do exist in my experience, I think that seems to fit. And of course, quality of carbs plays into that as well. All right, so I'll admit this may be a little unsatisfying as I'm not exactly saying for certain who should carb cycle and who shouldn't, but I believe it's all subjective and individualized. And some people feel better staying in ketosis long term, and some feel better cycling carbs. The only way you'll know is to do the experiment as long as you do it safely. And as I mentioned, if someone's using ketogenic therapy to treat a medical condition, I err on the side of not trying the experiment, but rather staying in ketosis. And as always, discuss it in detail with your healthcare team before making any changes. So I hope this perspective at least was helpful, and please leave us a comment and let us know about your experience with carb cycling. How or why you did it and what worked or didn't. We'd love to learn from your experience. So thank you for watching. I'm Dr. Bret Scher, and we'll see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.